Hi, my name's Georgia from Bien Australia. I'm a physiotherapist and expert in pelvic floor physiotherapy, and today I want to talk you through your pelvic floor anatomy. So when we're talking about the pelvic floor, we're normally talking about two layers of muscle. There's obviously nerves, fascia, blood vessels, other things that make up the pelvic floor, but we're specifically going to talk about the muscles. So everything that you can see in red here is the pelvic floor. So we've got a circle and ring of muscle around the entrance of the vagina, a circle and ring around the entrance of the anus, and then we've also got this muscle layer in the middle, which is called the perineal body. So starting off superficially, when these muscles contract, they shorten and close either the entrance of the vagina or the entrance of the anus. So their mechanism is a closing mechanism. So when you squeeze your pelvic floor, you want to feel either the entrance of the vagina or the entrance of the anus squeeze closed. And likewise, when you release the pelvic floor, you want to feel both of those muscle groups relax, drop down and open slightly. Then we've got this layer of muscle that's deep to them. So they wrap from the pubic bone around to the tailbone and then from the tailbone back around to the pubic bone. These muscles have a role of lifting. So they are, when they lift or when they contract, they are lifting and pulling everything upwards. So the entrance closes, the inner layer, the deeper layer lifts upwards. These are the muscles that are supporting the bladder, the bowel, the cervix and the uterus, and that support a growing pregnancy when bub is getting bigger and the uterus is being heavy onto the pelvic floor. They also are the muscles that largely are responsible for preventing prolapse, and both the deeper layer and the entrance layer need to both be able to relax adequately in order for something like penetration, bowel movements or opening your bladder to be comfortable and effective. When you're contracting your pelvic floor, we want to feel both that closing and that lifting. Likewise, when you relax it, we want to feel that dropping and that opening of your pelvic floor. So ensuring that you're feeling both of those movements is really important to a well-functioning pelvic floor. You can assess yourself and see if you're feeling the muscles at the entrance of the vagina and the muscles deeper to the vagina really lift, squeeze and close. So if you insert one finger into the vagina, you should feel the pelvic floor squeeze and lift around your finger, and as you relax it, you should feel the pelvic floor drop and open around your finger. You could also do this externally by putting a hand on your perineum and pushing upwards towards your belly button, and then contracting and relaxing your pelvic floor, and you should feel a slight lifting and a slight lowering onto your hand in that position. The best way though to get an accurate assessment of your pelvic floor and to figure out if you are correctly activating it and relaxing it is to see a pelvic floor physiotherapist, because truly you need somebody who knows what they're feeling to assess you to tell if you're activating it correctly. For more information about your pelvic floor, pelvic pain and all the other offerings we have at Bien, you can head to bien.com.au.